There is a general notion that cancer only affects adults and children are often spared. This is wrong. In India, every year 50,000 children are affected by cancer, and all over the world it amounts to around 3 million. Namaste, I'm Dr. Nithin SG, consultant medical oncologist. February 15th is celebrated as International Childhood Cancer Day. This is a campaign to spread awareness about cancer and to provide support to all children who are suffering from cancer, their family members, and to cancer survivors. Even with advancement in treatment of cancer, survival for childhood cancers still remain low in our country. In Western world, the survival is in the range of 80 to 90%, while in India it's only 30 to 40%. The main reason being lack of awareness among the public, and hence most of the cases usually present at an advanced stage, and also lack of accessibility to good care. Let's discuss a few facts about childhood cancers. When we compare childhood cancers with adult cancers, in general, in adults, cancer usually arises from organs like breast, lung, mouth, etc. But in children, the cancer types are quite different. The survival of these cancers are very good if you are treated at an early stage. In children, the most common cancer are blood cancers or leukemias, followed by brain tumors, cancer arising from bone, joint, and there are specific unique type of cancers which are only seen in children and not in adults. These include a cancer arising from the eye called retinoblastoma, or a cancer arising from the kidney called Wilms tumor or nephroblastoma. Unlike adults who can actually identify their signs and symptoms and consult a doctor and get evaluated, in case of children, the parents need to be aware about the symptoms. They have to be keen to find out the signs of these diseases and have to get evaluated. Let's discuss a few symptoms which are associated with childhood cancers. This could be put down into a short form: children. C stands for continuing or unexplained weight loss. Without any reason, the baby is losing weight. H for headache, which might be associated with vomiting or blurring of vision, and mostly headache will be more common in the early morning hours. I for an increasing pain or swelling in bone, joint or back, which would make the child difficult to play. L for lump or swelling in the neck, groin or armpits, or sometimes in abdomen. D for a development of a white reflex within the eye. This is classically seen in a childhood cancer called retinoblastoma. So if you take a photograph of the baby, or if you show a light into the eye of the baby, especially in a dim light, you can see a white reflex instead of a red reflex. R for recurrent fever. The baby will be getting fever every now and then, but there won't be any associated infection, or the reports would be usually normal for infectious cultures or infectious tests. E for excessive bruisability or easy fatigability. Excessive bruisability or excessive bleeding is very common, especially in blood cancers, because of falling platelet count or clotting abnormalities. Babies will have bluish patches developing on their skin while handling or with trauma, red spots over the skin, or sometimes bleeding from gum, nose or other orifices. N for noticeable paleness. Baby will be getting paler or pale over the time, and there might be excessive fatigability, especially while playing, which would actually reduce their activity in general. If you identify any of the symptoms, you need to consult your doctor and get evaluated. Childhood cancers, as I told earlier, have got a very good survival if treated at an early stage. So you need to get consulted, and if there is any evidence of malignancy, it could be treated very well by chemotherapy, surgery, radiation, and usually blood cancers, especially leukemias, that is more common in children, are very well curable with standard treatments. Those patients who have got advanced disease or who are not responding to the common standard therapies, we can go for bone marrow transplantation, especially in case of blood cancers, which also have got a good result. So stay informed. Our children are our future, so let's extend a healing hand for them. Thank you.